Dr. Pat Hawkins.
Good day, Chairman Contender, distinguished council members and staff. I'm Dr. Pat Hawkins, the Clinical Director of the D.C. Community AIDS Network, a newly formed nonprofit AIDS service organization. D.C. CAN's mission is to provide comprehensive HIV/AIDS prevention, care, and treatment to the LGBT and people of color communities. And it is the vision of Mr. Peter Metaxas, a lifelong community activist and a provider of HIV/AIDS services for many years. I am a licensed clinical psychologist with more than a quarter-century experience treating people with HIV/AIDS and people with mental health and substance abuse problems. In addition, in my prior role as Associate Executive Director of Whitman Walker, I worked extensively and closely with dedicated advocates such as Wayne Turner beside me on passing the original referendum for marijuana. And I designed and implemented the first health department certified community-based needle exchange program, now known as Prevention Works. I'm here today to testify in support of the medical marijuana bill, but I'm not here to once again review the numerous scientific-based studies, including the recent releases from the University of California, which for so many years have conclusively shown the positive impact of medical marijuana on the suffering of the sick and the dying. Sitting at the bedside of hundreds of clients dying from AIDS, I know firsthand what a difference medical marijuana can make, and I know how complicated, frustrating, legally risky, and personally unsafe it was for clients or their caregivers to secure anything resembling the quality and dosage dependable marijuana they so critically needed. Street corners are not pharmacies, but this bill gives us the chance to finally develop an effective quality-based marijuana production and dispensing system which can be a model for the nation. Let me be clear, this bill is not about legalizing marijuana or making it easily accessible to the general population. That is a debate and decision for another time and place. This bill is making sure that marijuana production and distribution is appropriately licensed, monitored, and controlled to ensure dependable dosages, minimum contaminants, maximum quality, and to prevent any inappropriate or non-medical use of this powerful psychoactive subject. To this end, I support the following recommendations. Only individuals medically documented as having qualified serious or life-threatening conditions shall have access on the basis of recommendations from primary care specialty physicians. And these diagnoses should be determined, qualifying conditions, by a medical panel convened by the Department of Health. With needle exchange programs, as is there, clients should have proof that they are from dispensing sites of ID that they are able to transport marijuana legally. Production and harvesting, etc., should be controlled by the Department of Health and monitored by the Department of Health. Dispensing sites, there should be at least 5, possibly 8, one in each ward, geographically distributed within the District of Columbia, and they should be monitored by the Department of Health. In addition, I think it might be appropriate to encourage dispensaries to be co-located and or affiliated by MOUs with traditional pharmacies with the history and expertise to appropriately implement the proposed dispensing protocols. Finally, there needs to be treatment access for people who develop a dependency who no longer need the medical benefits, and we need to have a community advisory committee appointed by the council or by the Department of Health, which could ensure the implementation of this situation. Thank you.
Thank you, Dr. Hawkins.